everybody. I'm Greg Stock, CEO of Thibodaux Regional Health System. It's a pleasure today to talk with Dr. Sharis Steib. She's a great young woman, very well trained from this area, and we're going to introduce her. I'm not going to go too much further here and introduce herself, but really great young doctor who's recently joined the staff at Thibodaux Regional and is starting her practice, and we so much appreciate having you here. You want to introduce yourself a little bit further?
Yeah, of course. I'm thrilled to be here. So like you said, I'm Sharis Steib. I was born and raised in Vacherie, Louisiana, back Vacherie to be specific.
Yeah.
I'm a proud graduate of St. James High School. I did my undergraduate training at LSU in Baton Rouge, where I graduated in biological engineering, so I bleed purple and gold, of course. I took a gap year, and I actually taught in Assumption Parish at Napoleonville Middle, so very adjacent to here. Yeah,
that's awesome.
Yeah, my students would encourage me while I was on my interview trail. It was a good time. I went to med school at LSU New Orleans. And I knew then that if I did not leave, then I never would. And so I knew I had to leave for residency. So I stayed local for intern year. I completed that at Our Lady of the Lake in Baton Rouge.
Yeah.
And then for residency, I did physical medicine and rehabilitation at the University of Michigan in Ann Arbor. So I actually really enjoyed my time there. I stayed an additional year and completed a pain fellowship there as well.
That's a lot of training. But why don't you talk for a moment or two about what PM&R is? What is it?
Yeah, of course. So PM&R really was developed after World War II in the polio epidemic. And so during those times when people were returning from war, we noticed that they had a lot of functional impairments. And they wanted to find a way to address these impairments and help them maintain their independence. And as they developed this field, they realized that a lot of people have functional impairments. You know, as we age, we develop functional disabilities. Patients who have strokes, spinal cord injuries, traumatic brain injuries, sports injuries, end up with functional impairments. And so really the field was developed to see how can we help people maintain their independence and function, whether it be at a high level or a low level, whatever level it is. Meet you where you are and find ways to help you sustain a meaningful life and a functional life. We want you to stay in motion, we want you to stay healthy, we want you to stay happy. And when I got deeper into my training, I realized that there are interventions that we can do to really, first diagnose what the actual issue is, and then target those specific problems. And so it's such a blessing in my training to see that these interventional techniques, everything doesn't have to be solved with surgery. Everyone isn't a great surgical candidate. Some people have had surgery and it just didn't work. And so what can we do to help you stay functional? How can we improve the quality of your life? How can we reduce your pain so you can do the things you love? We can do that through medication management. We can do that through different rehabilitation processes. And we can do that through non-invasive procedures and non-operative procedures. So ultrasound-guided procedures, procedures in the fluoroscopy suite. There's many things we can do. You know, we can talk about your different pacing, what you want to do and how you can do it. If any bracing is helpful, there's a spectrum. And so another big component of pain is just understanding. Where's my pain coming from and why? So we can talk about that. Once people understand what's happening with their body, I feel like it's easier, and a lot of times they express gratitude just to be able to know and understand.
Well said, young lady. So again, we're here with Dr. Sharis Steib from Vacherie, Louisiana. Really cool place over there. So thank you for coming. Really a pleasure to have you here today.
Of course, thank you for having me.